In our next discussion, we're unpacking one of the most talked about and often misunderstood topics, weight loss. But instead of crash diets and quick fixes, we're taking a closer look at sustainable strategies and the role that lifestyle really plays in the journey to better health. Joining me now for this discussion is Dr. Mark Opperman from the T Clinic. Now, Mark, there's a lot of conflicting advice out there. There are crash diets, there are fad diets, there are all sorts of things that are going on. But what is needed in terms of a sustainable approach to fat loss that is going to last?
Michael, you need to get into healthy habits. It's as simple as that. Here we go back to the cornerstones. You need to have some physical activity. You need to eat a healthy, balanced diet, high in protein, good fats, and low in carbohydrates. The things that you cut out are the refined carbohydrates. So if you can't see how anything is grown, you should be staying away from it. So there's no bread on a tree, there's no ice cream on a tree, they processed foods. But, you know, with whole dairy, it's brilliant for you. Then I think the things that people overlook. Stress and management of stress is crucial. Anxiety, depression leads to obesity. We spoke about it earlier in the season. And then sleep. Sleep is so incredibly important because it's what allows the body to recuperate and repair itself. And if there's dysregulation in that, it leads to changes in the body's function, and that leads to physical signs and symptoms, which leads to harm, the definition of a disease.
Right. Now, Mark, last week we spoke about obesity, and I want to ask you about solutions for managing obesity that are beyond just the diet and exercise. Are there other things that we need to be thinking about that are going to have an impact on this holistic process?
Michael, absolutely. I think when we talk about weight management, it's trending. It's been trending positively and negatively for the past couple of years now. What we need to understand is that weight loss medications aren't new. They've been on the market for many years in different guises. The new weight loss medication were actually formulated for the use in diabetics, and then it's been re-registered for the use in obesity as well, or for weight management. But the actual fact is that these medications work on metabolic function. So they can change and optimize how the body should function, from loss of fat mass to lowering cholesterol, decreasing inflammation, protecting the brain, protecting you against heart disease and cardiovascular problems because of the method in which the medication works, and also protect your kidneys. So it's not just about, I want to look good. It's these medications can actually make you healthier in the long run.
Right.
Remember, obesity is a disease. It's a chronic disease. And therefore, just like other diseases, it needs to be treated effectively.
Right. Mark, I'm going to say it as in extreme cases, but maybe in any cases, is there a role for surgery and other procedures that would be advantageous in helping an obese patient to overcome their condition?
Michael, yes, bariatric surgery does have a role to play. And before the GLPs and the incretin-based medication became well known in mainstream, it was probably the cornerstone of treating severely obese patients. When you want to embark on this journey, you need to go to someone that can help you, someone that specializes in this. And this might be an endocrinologist, it might be your corner GP that work a lot with this, nutritionist. It's a multidisciplinary approach. And I want to say that actually this starts with a psychological part of
absolutely.
it. Because if you are not prepared psychologically for the journey that's ahead, it really, really is difficult. Hormone optimization absolutely plays a role here. Nutritional support plays a role. So anything from supplementations to nutritional advice.
Right. I want to ask the question of, so there are those who are already overweight, obese, and there are those who are not, but maybe on the road too. How do you set up yourself in terms of lifestyle to manage or prevent being overweight?
Michael, I think, it starts with focusing on a healthy, balanced diet. And we have wonderful nutritionists that talk about that on your show. High protein, the body needs protein to build muscle. And when we have strong, good muscle fibers, they actually help us to manage your lipid metabolism and burn fat.
Okay.
We need healthy fats in the diet. And here we're thinking of those common ones like nuts and avocados and olive oil. Think of anything that comes out of the Mediterranean. And then carbohydrate intake that needs to be controlled. You need carbohydrates, it's essential for life. But we need good carbohydrates. And this comes from your fruits and your vegetables. The problem lies that all the stuff that we've just mentioned are expensive. And people don't have free access to them anymore unless they grow or cultivate them themselves.
Yeah.
Exercise. For children, 120 minutes per day, physical exercise.
Okay.
Not 120 minutes exercising your thumb.
Yeah.
Same with adults. We need 150 minutes per week. So it's not a lot. I always tell my patients, if you walk once a day around a big block, whether you take it in your lunch hour and you go and walk around the block of the office, or whether you come home and you take the dogs for a walk, that helps.
Right.
And that's how you start. Slow, small things, body is not sore, it's something that you can manage in a short period of time. Make it a habit. That's where you start with this. Focus on the quality of your sleep and get a sleep pattern.
Right, right. And in terms of our daily lives, we are bombarded with so many things. There's social media, there's work, there's emails, there's phone calls. Stress is a huge factor and it's difficult to eliminate it completely. So managing that and the importance of it in terms of managing your weight?
Absolutely. Stress elevates cortisol. Cortisol is going to increase blood sugar levels. It creates a dysregulation. It leads to chronic fatigue, etc., etc. In one of our earlier discussions, we took a look at first signs of hormone imbalances, and stress is one of the major causes, which leads to weight gain, low libido, mood changes. So you have to manage your stress, which is difficult. We can talk about stress for weeks in separate episodes, so maybe we'll do that.
Yeah.
But management of stress, we don't know how to do it.
Now, Mark, you've talked about the team in terms of endocrinologists, dietitians, your GP potentially. What about the other people in your life, friends and family? If you really need to embark on this journey to get yourself back on track, how important it is to have a support group who supports you?
Michael, I think it starts at home. Any wife will tell you, or anyone that's responsible for cooking with a family with different appetites or different desires out of what they eat, will tell you that it's almost impossible to please everyone.
Yeah.
So starting with your children from a young age, teaching them how to eat healthy. When you want to embark on this journey, everyone in the house needs to eat the same types of food, at least. The medications, and we'll take a quick deep dive into them in the next episode, helps us to eat less, smaller quantities, but it needs to be food that's high nutritional value and not empty calories. So men really like the way that you have to eat when you're on these medications, because it's high protein and high animal-based products, and yes, we need to bring in the fresh fruits and veggies, but we can do it in a way that's really, really nice. So it starts there, and then reach out to a support group in your area. I think we still had those Wayless groups and stuff like that. That really helps. You can't do this on your own. It's really difficult.
Mark, thank you so much. I think this just opens people's eyes, hopefully, in terms of weight loss, what they need to be doing, how they need to get themselves going, and also the support that they need. So thank you so much for sharing with us.
Pleasure.